I'm 3 on your side's Gary Harper. A Phoenix woman is stuck with a medical bill, a bill that she says she shouldn't have to pay. Now, she does claim her insurance company is willing to pay it, but there's a problem.
Lori Klipfel says she has spent hours poring over a medical bill that she insists she doesn't owe.
To me, it's almost like harassment because it's not really legitimate.
Back in October, Lori says her husband Todd didn't feel well and was having chest pains, so she took him to an urgent care facility, which immediately told her to take Todd to the hospital.
So we chose Mercy Gilbert because it's on my medical plan. And he had a bunch of tests run there.
The good news, Todd turned out just fine and was released from Mercy Gilbert Medical Center. The bad news, he and his wife Lori keep getting a bill for just over $1,500 from a company called Premier EM Medical Specialists, which evaluated Todd while inside Mercy Gilbert Medical Center. Lori says it's a bill her insurance company, United Health, is happy to pay once it has all the correct billing information from Premier EM.
The insurance company said they did not provide any type of notes or procedure codes, anything. Just this is the bill, and they denied it.
If it sounds familiar, 3 on Your Side profiled a viewer back in April who had the exact same problem with Premier EM for the exact same amount, $1,516. After our involvement, the insurance company successfully resolved the issue with Premier EM after finally receiving all medical information. Lori says she remembers seeing that 3 on Your Side report.
They're the ones not providing or working with the insurance company, providing the proper notes, diagnosis codes, things like that. It should not be up to the patient to have to fight that and to give the proper diagnosis codes.
So Lori contacted 3 on Your Side, and I reached out to Mercy Gilbert regarding Premier EM physicians. The hospital refused to provide information, but said in an email that they work with a number of community providers who are not directly employed by the hospital. In these instances, patients may be billed separately from the hospital and from the physician group. 3 on Your Side also tried several times to get a hold of Premier EM, but heard nothing back. However, after contacting United Healthcare, I got an email saying, "We requested that Premier EM physicians submit the proper documentation for these claims, including invoices with appropriate medical codes, so we can address this issue." Lori says with 3 on Your Side's help, the issue looks like it's headed in the right direction. But she maintains she shouldn't have gone through all this turmoil.
Well, that's what I thought. Holy cow, it's happening to how many people?
So it looks like this issue is on its way to being resolved. I'll certainly let you know if it is in a follow-up report. I'm Gary Harper, 3 on Your Side.